Negative trend we're seeing during this pandemic is substance abuse. Sales of alcoholic beverages have skyrocketed. Joining us now to talk about that is Dr. J. Craig Allen, Medical Director at Hartford Healthcare's Rushford. Doctor, welcome, and tell us what Rushford is.
Well, Rushford is a behavioral health and substance use treatment organization located in central Connecticut. It's part of the behavioral health network of Hartford Healthcare.
Excellent. All right, tell us what we're seeing in Connecticut for alcohol sales in these times.
Well, I just saw an article recently that said online sales increased by around 250%, and in-person sales was over 20% through the middle of April. We're certainly seeing an increase in people with alcohol-related problems in our treatment facilities, both in our substance use treatment facilities, but we're also seeing them in our acute care hospitals across Hartford Healthcare, people being admitted for medical or surgical reasons, having an underlying alcohol problem, and so we need to be vigilant about that and try to pick up on those patients as soon as we can.
What challenges brought on by the pandemic do you attribute to that rise?
Well, people that are becoming isolated, maybe they can't go to work, the normal routines that they use to stay healthy have been disrupted. All of these things can lead people to try to get some solace, and maybe drinking alcohol or using other recreational drugs gives them that solace for a few moments. But with things like alcohol and marijuana, there's an impact on your sleep, on your mood, on anxiety, and certainly on your judgment. So that can all be problematic.
Tell us what Hartford Healthcare has done in response, or what programs are in place to curb the increase.
Well, we've kept our treatment programs open and our assessment programs open throughout the quarantine. We went completely virtual using different platforms for telehealth with video or telephonic, and we continued to have in-person programs, but we were using physical distancing, safe socializing strategies, using masks, using sanitizer, both for staff and for patients. So all of those things were helpful. We have the care line that we're using through the Behavioral Health Network and Hartford Healthcare, where anyone from the community can call if they're concerned about themselves or they're concerned about a family member. So those are some of the things we've done to reach out, along with our recovery support specialists, who are people with lived experience who try to reach out and connect with people. And we've tried to stay in touch with all of our patients, particularly if their ability to work with us has been disrupted.
And what do you think it will take to bring down the numbers? Is Governor Lamont delaying the opening of bars helping? Do you think that is a good thing right now?
I think so. I don't, I think that could have been problematic. Mixing something that is disinhibiting, that impacts your judgment, with an environment where you need to maintain physical distance and safe socializing. So I think that was a good decision. Education for the population and work on identifying other strategies to manage anxiety, organize your day, physical exercise, safely socializing, connecting with other people, wellness activities, meditation, other kinds of interesting hobbies and things you can get involved in are all really, really important.
All right, Dr. J. Craig Allen with Hartford Healthcare's Rushford. We appreciate your insight. Thank you for your time today.
Thank you.